Well, let's begin with those developments in the United States. Officials say the country will soon be accepting international flyers inoculated with COVID-19 vaccines that are approved by the WHO. Now, that is good news for Canadians that have received the AstraZeneca shot. But what is less certain today is how people with mixed doses are affected. So for more, let's go to Laura McQuillan. She's looking at it for us today. So Laura, what do we know about these changes now coming out of Washington?
Yeah, so this is going to come into effect next month, Michael, early next month. And as you mentioned, needs to be a shot approved by either US regulators or the World Health Organization. So opening that up more to travellers, the US having shut out many international travellers to date. Those vaccines, I'll walk you through the details. Pfizer, Moderna, Johnson & Johnson, all approved in the US. But then you add in this change that includes AstraZeneca. That affects many Canadians who got that shot. The Covishield vaccine produced by the Serum Institute of India, also approved by the WHO, as are two Chinese manufactured vaccines, Sinovac and Sinopharm. Neither approved for travellers to Canada at this point, approved in dozens of other countries though, and the US will be allowing those travellers in too. But that big question remains, what happens with those Canadians who got mixed doses? Whether that was a Pfizer and a Moderna or an AstraZeneca followed by an mRNA vaccine, no clarity on that point. The US doesn't currently recognise mixed doses, and so many Canadians will be wondering the question, of course. I reached out to the Centres for Disease Control and Prevention today, waiting for an answer, though yesterday they said they'll release additional guidance and information as the travel requirements are finalised, heading into next month. We learned yesterday that Canada has been lobbying the US quite hard on that issue of mixed doses. It has been providing health officials there data about the effectiveness of having mixed doses, which can in fact have an equally strong or even stronger immune response than just getting two of the same dose. And we heard more from Chief Public Health Officer Dr. Theresa Tam on that point yesterday. You'll note she uses the word schedule. That's a reference to the way that Canada uses these vaccines. Take a listen.
We've presented the information that we have about our schedules and how they've been working for us, as well as the international literature showing the efficacy of and safety of these schedules. So we are waiting anxiously to see what they will be doing at their end. But let's just say we have left no stones unturned to advocate for the vaccine schedules here.
Now, Canada has successfully had some of those conversations with other countries. It's been talking with some destinations, with European Union countries, with the UK, and in fact, you've seen Barbados, England, Ireland, or rather Northern Ireland, allowing people in if they have mixed doses. The Republic of Ireland not yet changing its position. So for many travellers, whether they're going to the US or elsewhere, Michael, mixed doses do remain an issue right now. We'll be keeping on top of what the US has to say about this as soon as we get any information out of them.
Okay, Laura, thank you for that. Our Laura McQuillan, and of course, we'll keep tracking the story for you today.